somebody who suffered from a birth trauma or a birth-related trauma. Maybe you're listening to me today because you've had a stillbirth. Perhaps you're somebody who's had a miscarriage or multiple miscarriages. Maybe you've lost a baby through sudden infant death syndrome, or maybe you're grieving the loss of a good birth experience. You've actually had a traumatic birth. Well, my name's Jenny Mullen, and I've been helping women get through this experience and recover from this experience very quickly and effectively, spanning over the last 2 decades. I'd like to ask you a few questions so you can see whether you are somebody who could possibly be suffering with something that we call post-traumatic stress disorder. Now, there are many signs and symptoms that you may be suffering with. I'm just going to name a few now, see whether you recognise that you're actually suffering with those. It may be that you're getting intrusive, very distressing thoughts, and this could be happening daily and often. Maybe you're waking up in the middle of the night in a state of panic. You've had a nightmare, a really bad dream related to your trauma. Perhaps you're somebody who gets flashbacks during the day. You actually feel like you're reliving it. You could be somebody who's starting to withdraw. And that's often what other people, some people start to withdraw from family members, even from other children that are still living. They don't want to think about the trauma. They don't want to think about their feelings. They don't want to remember it. They don't want to remember anything associated with it. And they will withdraw, often to the point of losing contact. People start to get confused. They can't think straight. They're hyper-vigilant, they're looking out for a tragedy to happen. The worry is intense. And I would ask you, that sleep is often very, very much affected. But I would ask you if you're having some of these signs and symptoms, and I would describe it in a nutshell as living a nightmare. Well, the good news is you really don't have to suffer. Right, I've been treating women for many, many years now, helping them on the road to recovery very, very quickly. And there's a wonderful treatment now available, and it's called the rewind technique. And I've been helping people. What happens actually in the brain, I'll describe very, very briefly to you, that there's a part of the brain that records the trauma memory, and it keeps firing a trauma response actually to protect you. It thinks if it tells you to panic about everything, it can protect you from another trauma. But actually, we want to get that memory, and I can help you do this. We take that memory into the normal part, the normal memory, and the neocortex, the thinking brain. And when there, you can remember the experience, but without feeling ill and without suffering the trauma. All right? So what I'd like to ask you to do today, if you are suffering from any of these signs and symptoms, and I do, believe me, I know how distressing it is, know that it's treatable. Know that if you were to have just a few short sessions of psychotherapy, I'm a human-given psychotherapist and I'm a clinical hypnotherapist, if we were to just have a few sessions together, you could actually release these feelings very, very quickly. In fact, I've had patients, even in one session, say they feel dramatically different. So you really don't need to suffer. Grieving is normal after a loss. Being in denial or moving into anger and then blaming yourself and feeling a little bit down, or sometimes very down, for a few weeks and months, that's normal. That's part of the grieving process. But you don't need to suffer with the post-traumatic stress disorder. That's not part of grieving. And I can help you as a therapist release that so your grieving will be gentler and shorter. And if you're somebody who is starting to suffer with severe depression, and by that I mean you're going through the grieving, but after a month or so, it's not starting to lessen. In fact, it may even be getting worse, and you may start to feel feelings of depression, where you don't want to get out of bed in the morning. Your energy is low. You're starting to panic. You may even be having thoughts of killing yourself. You don't take pleasure in life anymore. That's not normal too. Not after a few weeks and a few months. All right, so it is normal to have severe feelings for a few weeks and months, but after that you shouldn't suffer anymore. Please, if you're one of those people suffering with a birth trauma, birth related trauma, please do come and see me, because I can help you. And if you have a look on the website today, there's a phone number that you can call, and you'll go through to my reception service and they'll take the number and I will call you back and have a chat with you and see whether they can meet your needs. But please do, don't suffer in silence, and I know many do. Please come and see me, because help is available. I really can help you.